Howdy Ocean Ambassadors, I'm Neha and I'm here at the Marine Mammal Center in the surgery room. Everything we do here for our patients is based off of observation. Staff and volunteers are always looking out for different symptoms in our patients. For example, if a staff were to see that a patient is not using its hind flippers, we might think that an x-ray is necessary to diagnose that patient. Here we are in the x-ray room. You might recognize the x-ray room. If you've ever been injured, your doctor has taken an x-ray to see if there's been any broken bones or any other way that you've been hurt. We take x-rays for our patients for a couple of different reasons. One, if they've had a broken bone or we notice that they might, or if they have something called pneumonia, or if they've swallowed something that we could see inside of their stomachs. We've got our patient here on the table that has just come in from the knockdown pen where our volunteers give them medicine to put them to sleep. So our patient here is an elephant seal pup, and she is hooked up to a monitor that's telling us all the vital signs going on in her body. You'll see here there is a reading for the pulse and the oxygen level here, and that would be telling us how the animal is doing while it is under anesthesia. When an animal is under anesthesia, we have to breathe for it. With marine mammals, they are voluntary breathers, unlike humans, so they have to think about breathing. So they can't be put under anesthesia for a procedure or surgery without us breathing for them. So we've got our ventilator here that's pumping oxygen into our patient, and as the patient breathes out, just like humans, it's breathing out CO2, or carbon dioxide. One interesting thing about the ventilator is that we have to insert a tube inside of our patient's throat. So if you were at the hospital, they might use a tube this size. For a newborn baby harbor seal, we use a tube this size. And for a stellar sea lion, we use a tube this size. We've also got our patient set up on a sub-Q, which is just kind of a fancy word for a way for the patient to be hydrated during a procedure. You might recognize this as an IV at a human hospital. The only difference here is we're not going into a vein with this needle, we're going into a place right underneath the skin. Another tool we use here at the Marine Mammal Center is an ultrasound machine. The ultrasound machine you might recognize is for a pregnant woman. We can do the same thing for a pregnant patient here, but it can also tell us all about soft tissues in our patients. For example, if we were to use an ultrasound machine on our patient here, just put on some gel, and our reading would show us the heart and all of its valves. That could give us a better look at what the patient is doing and why it might be here. All right, Ocean Ambassadors, now it's your turn. You're going to receive some test results and you're going to have to figure out how to treat your patients. Are you ready to operate?